Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, National Epidemiologist, Dr. Charlotte Ahmed, and Deputy Coordinator for the Reopening of Borders, Mr. Colin Piper, media partners, ladies and gentlemen here and abroad, good evening. We welcome you to yet another COVID-19 update being brought to you by the Ministry of Health, Wellness and New Health Investment. Let's get right into business this evening, and we'll begin with an update on some statistics by Dr. Charlotte Ahmed.
Thank you, Ms. Harris. My pleasure to be here updating you. Currently, the number of confirmed cases of COVID-19 is 18. There were 2 positive cases on rapid antibody testing over the weekend. Subsequently, they have tested negative using the PCR method as per protocol. These individuals are Dominican returnees. They had their negative PCR results prior to their arrival. They have completed their online screening questionnaire, and they met the criteria to travel to Dominica. They did not have any clinical symptoms of COVID. On arrival, they did not have any elevated temperature. Currently, they are on mandatory 14-day home quarantine. As per protocol, all visitors coming to Dominica are required to do the following prior to arrival again. PCR testing should be done within 3 days from the arrival date. Just to explain, if you are traveling to reach Dominica this Friday, August 14th, then you must do the PCR test August 11, meaning tomorrow, and no earlier than August 11. It is mandatory to upload a valid negative PCR result in order to receive health approval notification. You must keep a copy of the PCR result and approval notification prior to the boarding. These documents will be checked during embarkation, and on arrival, you must submit them to the port health officer. The criteria to disapprove any visitor include no PCR test done, outdated PCR result, PCR result not uploaded, a positive PCR result, or clinically symptomatic case will be disapproved. The health questionnaire can be accessed via the official website at domcovid19.dominica.gov.dm. The front page will look like similar to this. Once you access this website, and it will ask, are you resident of Dominica? And once you answer that question, it will take you to the second page where it says Dominica Health Questionnaire. There are many other websites also doing this similar questionnaire. So you have to be careful that it is Dominica and it has the Dominican logo in it. And this questionnaire includes several sections, starting with demographic information, then we have flight information, then we have medical information, then we have some behavioral questions, as well as some PCR-related questions. And you must fill up all mandatory fields, and these are in asterisks, in red asterisks in that website. The questionnaire starts with demographic information. I want to highlight that the address, the local address or Dominican address with a phone number is very important for us. You are also asked to fill up flight information, which includes flight number. And just to specify and keep the same standard, only the last flight information connecting to Dominica is needed. Place of embarkation, that means the last airport, and date of embarkation, date when you board the last connecting flight. That's what is required. You also require to name all the airports that you are required to go through, starting from very first to the last airport. If you are traveling from Miami, then you should indicate that you travel from Miami to San Juan to Douglas Charles Airport. Then all countries that you have visited within the last 14 days also needed. That's important for our risk assessment. And then you could require to complete the medical information. We urge people that it is important to be honest in filling up this section. It will help to assess anyone with COVID infection. If you have a chronic medical condition, you need to mention it in the questionnaire so the necessary arrangements can be made on the ground as deemed appropriate. The last important section, that is questions from 19 to 22, and is about PCR testing. Again, a negative PCR result from a swab taken on or within 3 days from arrival date must be uploaded. Once you submit the questionnaire, you cannot edit it again. In order to rectify any incorrect information, you must reapply or resubmit, filling up the questionnaire all over again. And once you successfully submit the questionnaire, you will be given an 11-digit alphanumeric numbers. It will start with Q, U, and 9 more numbers. This number is very important in order to follow up in case in delay in response or somehow you have not received any notification, then you will be using this number to communicate with us, with the Ministry of Health. So with this, I thank you.
And special thanks to Dr. Ahmed for that update on our status here in Dominica, and of course for always allaying the concerns of the general public. Once again, we are at 0 active cases of COVID-19, 18 confirmed cases in our country, 18 recovered cases. Our last diagnosed cases were more than 70 days ago. So again, I repeat, no active cases of COVID-19 in Dominica. Our next presenter this evening is the Deputy Coordinator for the Reopening of Borders, Mr. Colin Piper.
Thank you, Madam Chair, and acknowledging the presence of Honorable Irvin McIntyre, the Minister for Health, Wellness and New Health Investment, and Dr. Ahmed, the epidemiologist. So good evening to all. My report will focus on arrival data to date, travel protocols, access, information on the COVID certification process for tourism service providers, information on the certified properties thus far, and what we're doing as it relates to training. As at today's date, August 10th, we know that Dominica opened its borders on July 15th to nationals and residents, and on August 7th, 2020, to all travelers, including non-nationals. Since July 15th, we have had 487 travelers to Dominica. 173 of those travelers came to Dominica since August 7th, when we opened to non-nationals. But at this time, we're not able to indicate how many, in fact, are non-nationals. Now I'll just go over the protocols, and they're worth repeating. Protocols for travel, compulsory requirements for all arriving passengers. We have travelers must, as Dr. Ahmed mentioned, submit a health questionnaire online at least 24 hours prior to arrival in Dominica at the URL domcovid19.dominica.gov.dm. You must upload a negative PCR result recorded within 24 to 72 hours prior to arrival. Travelers must present the following to airlines prior to boarding and upon disembarkation in Dominica. That is, a negative PCR test result recorded within 24 to 72 hours prior to arrival, and notification of health clearance to travel. General protocols and guidelines upon arrival. Travelers are required to wear face masks at all times during the arrival process, up to and including departure from the airport. Travelers must observe physical distancing guidelines. Travelers must practice good respiratory and personal sanitization, and travelers must follow all instructions of healthcare staff and officials. Upon disembarkation, travelers will be required to sanitize their hands at sanitization stations as directed, be required to undergo a health assessment to include a temperature check, and provide confirmation of the health questionnaire and negative PCR test results. They must be required to undertake a rapid test screening, and subject to a negative test result, the following will apply. Travelers will then be conveyed on to immigration for processing and to customs for screening, where their luggage will be sanitized and when taken off the conveyor belt. If, however, you show symptoms of a high temperature, high risk alert from questionnaire, or positive rapid test, then the traveler will proceed to secondary screening area. A PCR test will be administered to the traveler. Travelers will be sent on to mandatory quarantine at a government-approved facility or government-certified hotel at the traveler's expense, awaiting results. And if the test result is positive, traveler will be admitted to a COVID isolation unit until released by an authorized health professional. After your stay in Dominica and upon departure from Dominica, you need to be aware of the following: that vehicles transporting you to the ports of entry or departure will only be permitted to enter the air and seaport with the driver and the persons due to travel. Travelers must wear face masks at all times during the departure process until departure from airport. Travelers must observe physical distancing. Travelers should practice good respiratory and personal sanitization and follow the instructions of the health care staff and officials. As it relates to access, we know access into Dominica is very fluid at the moment. This is because the demand at present for travel worldwide is very low. And airlines, while publishing scheduled flights, are prone to postponing and canceling flights. So it is best to ensure that you are up to speed on the airline's travel advisories until the time of departure. It's also imperative that the travelers do their research to understand what health protocols, in terms of required testing and by when they must be done, are in place for the in-transit passengers at the hubs servicing Dominica. Such hubs would be at San Juan, St. Martin, Antigua, Barbados, St. Lucia, and Pointe-à-Pitre. Effective August 11th, the following airlines will operate into Dominica with scheduled service. We have Silver Airways on Thursday and Saturday from San Juan. We have Air Antilles daily from Barbados with connection at St. Lucia to Dominica. We have Air Antilles from Pointe-à-Pitre to Dominica. However, we know that the borders of Guadeloupe are not yet open. Inter-Caribbean daily from Barbados to Dominica. Winair on Monday and Thursday, direct from St. Martin to Dominica. And Winair on Thursday and Saturday from St. Martin via Antigua to Dominica. As relates to COVID certification, health and safety guidelines for the tourism and hospitality sector were developed by the Ministry of Health, Wellness and New Health Investment, Discover Dominica Authority, and the Standards and Protocols Subcommittee of the COVID-19 Tourism Task Force. These guidelines and protocols are to assist the industry to keep guests, employees, and the local community safe from risks of COVID-19 and to mitigate the spread. The guidelines are minimum operational requirements, and each service provider can implement more advanced guidelines if they so choose. And a PDF of the protocols are currently available on the Discover Dominica Authority website at discoverdominica.com. As relates to accommodation, properties must submit a COVID-19 action plan to the Environmental Health Division for review and appraisal prior to opening. The plan must detail measures put in place to address all areas of the operation to manage and mitigate the spread of COVID-19 amongst guests and staff. Following the submission of that plan, the Quality Assurance Unit of DDA and the Environmental Health Department will undertake an assessment to ensure the measures outlined in the action plan are in fact implemented. And if all minimum requirements are met, the property will be issued with an Environmental Health Department certificate of approval. Over the past weeks, the Environmental Health Department, in collaboration with the Quality Assurance Unit of DDA, have worked tirelessly to have all tourism accommodations operate within the established COVID-19 accommodation protocols prior to reconvening business operations. As of August 7th, 2020, 13 properties have been issued COVID-19 certificates of approval. And these certified properties are Cabritz Resort and Spa Kempinski, Banana Llama Eco Villas and Cottages, Atlantic View Resort and Spa, Hotel de Champs, Mango Garden Cottages, Riverside Hotel, Rosalie Bay Resort, Tamarind Tree Hotel, SeaWorld Guest House, Picard Beach Cottages, Portsmouth Beach Hotel, Secret Bay, and Fort Young. This translates to 415 COVID-certified rooms on island. A total of 28 properties have in fact submitted action plans to get COVID certified, and 17 of those action plans have been approved at present. We have 13 properties that are COVID certified, so 4 more need to pass the assessment, and another 11 need to have their plans approved. As relates to tourism taxi certification, a total of 32 taxi operators have received certification. This translates to a total of 44 tourism taxi vehicles, which have been issued with the COVID-19 approved decals. Of the 44 tourism vehicles, 33 operate out of Douglas Charles Airport, with the remaining 11 operating from the ferry terminal. Training is an integral component of the successful implementation and maintenance of these guidelines, and to keep visitors and employees safe. It is mandated that all tourism service providers be trained in proper health and safety protocols to ensure safe operations in a COVID-19 environment. Consequently, DDA, in collaboration with the Environmental Health Department, have embarked on a health and safety training series. Topics include COVID-19 causes and symptoms, infection prevention and control, including personal protection, including use of face coverings and other personal protective equipment, the cleaning, sanitizing, and disinfecting practices for tourism properties and vehicles, health and safety guidelines for the airport taxi, the airport tourism taxi service providers, car rentals, water sports, and sites and attractions. To date, 120 tourism service providers have benefited from the sessions. The next training session will target tour guides who are contracted by lodging properties and destination management companies. And the first such session will be held on tomorrow, Tuesday, August 11th. Additionally, a training session targeting hoteliers was held in collaboration with the Ministry of Health. This focused on the use of the Ministry of Health COVID-19 surveillance database. The main objectives of that database are to conduct an active surveillance for all guests staying at the hotels and guest houses, and to detect unusual events, incidents at the earliest time. So that concludes my report. Thank you very much.
And thank you so much to Mr. Colin Piper, who is the Deputy Coordinator for the reopening of borders. Of course, we all recognize Mr. Piper for his extensive work with the Discover Dominica Authority and his presence with us, as well as his appointment as the Deputy Coordinator of the team tasked with the reopening of borders is testament to the fact that this takes a cross-sectional approach to keep Dominicans safe. And before we wrap up this evening's press briefing, I welcome to the podium the Minister of Health, Wellness and New Health Investment, Honorable Dr. Owen McIntyre.
Thank you, Ms. Harry, our moderator. Before I begin, let me recognize our national epidemiologist, Dr. Charlotte Ahmed, Deputy Coordinator for the Reopening of Borders, Mr. Colin Piper. It is indeed a pleasure once again to address and update you on the ongoing COVID-19 pandemic. As you know, this is a crisis situation that the world is in, and as such, it cannot be business as usual. It calls for sacrifice from every one of us, for the good of us all. That is for the safety of our families, friends, neighbors, and our communities. This situation is a fluid and dynamic one, which is why we have opened our local economy and relaxed restrictive measures in a gradual manner, and our borders in a phased manner as well, putting the safety of the public as our primary concern with absolutely no compromise. But we are also mindful of the fact that we do not live in isolation, and we cannot remain closed forever. And for this, we have opened our borders with a phased approach. We did open our borders to nationals and residents on July 15th. But even prior to this, we brought home our students and cruise ship workers, and non-nationals from August 7th. There is always an associated risk of importing cases when borders are reopened. There are always major considerations prior to reopening, which we reviewed both from a local standpoint and from a regional standpoint. These include the level of COVID-19 incidence. Preferably there should be zero or just low incidence. The health system capacity. Thirdly, the surveillance and monitoring capacity. It must be able to respond to changes in indicators of health service capacity. Also, the testing capacity is also critical when considering opening of borders. coordination and communication mechanism among the stakeholders is just as important. Following these considerations, a proper risk-benefit assessment was done, which led us to the reopening of our borders. We must appreciate the fact that COVID-19 will be with us for some time, and we must learn to adjust our lifestyle and habits accordingly to remain safe but productive as well. We still have no active cases as we continue our surveillance and testing activities. The mere fact that we don't have any active cases gives you, the public, even more reason to adhere to the public health and social measures that you have been practicing over the past few months, and an opportunity not only to protect yourself from COVID-19, but to be part of Dominica's response in the fight against COVID-19. We must talk to each other, remind each other, and educate each other on the guidelines and measures that the Ministry of Health has put in place over the past few months. We are fully aware of the fatigue associated with these measures, but the fact remains that it works in preventing the spread of COVID-19 and the possibility of a second wave. We are urging you, the public, to please wear your mask when in shared places, such as churches, supermarkets, shops, buses, public gatherings. Please practice physical distancing, and please continue to wash your hands regularly, a minimum of 20 seconds, or if alcohol is being used, at least 70% alcohol and above. Continue practicing proper respiratory etiquette as regards to how we sneeze and how we cough. Continue proper sanitizing of your homes and your workplaces as well. We are making a special request to all business places to implement and enforce these public health and social measures. Bus drivers as well, make sure your passengers have their mask on. For those who have been discharged to home quarantine, be considerate. Be happy that you are home, but be responsible in your actions. We are humbly requesting you to comply and please remain at home. You have been out for months and years in some cases. Just 14 more days at home is all we're asking for. Equally as important for those of us who know better, it is to inform the healthcare providers or call the hotline when persons are not complying to home quarantine. We are also encouraging the public to report anyone who they suspect came in illegally to the police, healthcare providers, or call the hotline as well. These illegal entries pose a serious threat to our safety. So please, let's go back to basics and follow all the guidelines and measures that have been made available to you on the radio, the television, posters, banners, and through social media. Spread the word around and share the life-saving messages. And please avoid sharing unconfirmed reports. We can only succeed if we do it together. As I've said before, it must be an all-inclusive approach with a greater sense of public concern. I would like to thank all the local businesses and our international friends, the People's Republic of China, the Bolivarian Republic of Venezuela, and the Republic of Cuba, and all our frontline workers who've played an integral part in our fight against COVID. So let's go back to the basics: our mask, hand sanitizing, how we sneeze, how we cough in the public, our physical distancing, and let us inform each other of all the guidelines that we know about. Let's share it, let's do it together, and we can remain COVID-free as we are presently. I thank you, and may God bless Dominica.
And thank you very much to the Honorable Minister of Health, Wellness and New Health Investment, Dr. McIntyre. Just by way of reminder, the numbers for the hotline: 448-2151, 448-2153, 448-2156, 611-4325, and 1-800-219. And also a reminder of the website to access the questionnaire. That's DOM, D-O-M, COVID-19.dominica.gov, G-O-V.dm. That's DOM, COVID-19.dominica.gov.dm. Ladies and gentlemen, we thank you for joining us this evening. Once again, the protocols that have been established are in place to protect all of us, those of you who reside here and those of you wishing to come in. These protocols are evidence-based, and we have to continue to trust in the discretion of the experts. And also, let us all be responsible and encourage others to adhere to these protocols as well. Good evening.